Hello, welcome to Nuclear Health. I'm Dr. Vishwarup Ghosh, the founder of Nuclear Health website. So today we have two eminent uh, physicians, uh, Dr. Surya Parajoli from Nepal and Dr. Tanoy Maiti from India. So it's a discussions about why public health and mental health are the real future. It's an Indo-Nepal perspective. So today we are here to learn a lot of things regarding public health and public mental health. So public health is a broad term, right? So public health is not only on providing health services. Public health is also research. Public health also in awareness. Public health is also everywhere. So let's first would like to go Dr. Surya. So he's a public health expert. So I we would like to learn about some basic words about the public health from you, so that we know something from you about the public health.
Okay, thank you for giving this opportunity in your forum, okay, in this Indo-Nepal perspective regarding what is public health, what is public mental health, and different issues of health. So basically, WHO defines health as a state of complete physical, mental, and social well-being. Okay, physical, mental, and social well-being. So nowadays, it's more advocates for quality, not only the quantity. So quality of the life or disability adjusted life, where there are so many terminology nowadays. Jali, quali. I mean to say that we must have quality life, okay, based on physical domain, mental domain, what we are going to talk also here today, and social domain. And public health is more social domain, okay, social domain for population. And there are so many terminologies related to public health or community medicine or social, sometimes social medicine, preventive and social medicine, sometimes community, health. So there are so many terminologies, but the ultimate goal of public health is quality of life of our people. So I think that reflects better description for public health.
Yeah, that's a great point. So let's learn from Dr. Maiti. So could you please explain the mental health in connection of public health?
Yeah. So first of all, good evening from India and good evening from I think Nepal as well, and good morning from USA. So glad to meet all of you. And what Dr. Surya said in the same line. So I think public health is a base. Public health is a base over which we develop our health system, over which we develop our policies, and we develop our well-being. So the concept of public health is there since long, but unfortunately, probably in the Southeast Asian countries and also this part of the world, for major challenges, we often face hardship in implementing the proper public health interventions. So when it comes to mental health of the public or public mental health, so going to the population, going to the community, and engaging them into the health practices, the mental health practices, it itself become challengeable as you know, mental health itself is a stigmatizing, and still we are fighting about stigma, and we are scared since how long we need to fight even more, even if it's 2020. Other than that as well, the awareness in the community, if it happens a fever, if it happens a watery diarrhea outbreak, there the things, the alarms probably rings faster. But when it happens, stress in the community, depression in the community, then people keeps on coping, still it turns actually very difficult for them. So the I will say, in my experience, definitely Dr. Surya can give a better account, I believe. The public health concept and intervention itself is challengeable. And when it comes to public mental health, everybody has a mind and every mind need to be taken care of. There also, we do face a lot of gap, which probably will come to today's discussion. And we have seen what we faced during the current ongoing pandemic, where the preparation was there in the public health domain, but the public mental health was so neglected initially, which after we are facing now. And I definitely thank New Grad Health for bringing up this beautiful topic to discuss, and we will definitely discuss on the details about it. So the public mental health concept, I will say in one line itself, is quite neglected. When the public health comes, it comes mostly for sanitization, diarrheas, it's for some vector-borne diseases. But the community itself has a mind, and community, every individual in the community, they themselves have a mind. So we often do forget that, and it's high time we intervene there. Over to Dr. Bishwaro.
Yeah, that's a great point. So during basically this COVID-19 pandemic, there is a huge crisis of public health management. So there are lack of infrastructure, there are lack of sometimes leaderships. So there are so public general people right now are in a dilemma to face it differently. Like the due to the lack of infrastructure, the lack of understanding of the COVID-19 awareness. So in this regards, what we have learned. So could you please, Dr. Surya from Nepal, recently it is also reported there are a couple thousands, like more than 37,000 people in Nepal right now infected by corona, SARS-CoV-2 virus, and few people, like more than 200 people, already died. So in these situations, how do you measure the corona pandemic publicly? Like how what will be the strategic plan? How the infrastructure will help to defeat this pandemic state?
Okay, good question. So it's almost similar in the global context, even in Indian context or Nepalese context. It is
Yeah,
somehow
exactly.
same regarding,
Hmm.
because this is a novel coronavirus, so it's a new for all of us. And what we are practicing since last 5 6 years is that we are basically, shifting our expertise, our budget, or our policies to non-communicable disease entities, because we have recent epidemiological transition from communicable disease to non-communicable disease, and we are basically working for advocating for non-communicable disease like budgets, manpower development, training, infrastructures, and there is some gap, okay, in healthcare system regarding occurrence of global pandemic like for COVID-19. Okay, so there is a huge gap at clinical medicine or at individual medicine at hospital setting, even at community setting or population health or public health, and we have huge gap in the social domain, social health. Actually, the most important gap in this ongoing COVID-19 pandemic is social gap. It's not physical and mental gap. Actually, the social gap is more, which creates mental gap as well as the physical gap. So we need to think about more physical health, mental health, and social health, are all aspects of health. Otherwise, it's very difficult, to manage, increasing burden of COVID-19 as well as a stigma or post-COVID challenges like social acceptability or community participation, okay, for prevention and control of COVID-19. Another is like maybe impact of direct or indirect impact of COVID-19 on education or occupation or daily well-being. So these things needs to be considered. So it's beyond the health concept. We need to think about all the aspects of not only physical, mental, and social, but about the economic condition which leads to poverty or educations and mental boost up. These things we need to consider. Thank you. Over to you.
I'm coming to Dr. Tonai Maiti. So we as an Indian, like in Indian perspective, if we think, we may have seen there are more than 2.5 crores people right now in basically in globally infected, where 8.4 lakhs people is already dead. While in India, we have like 34 lakhs people infected, while like 26 lakhs people already recovered. So it's a good sign. A huge number of people already recovered. So how we will explain then how India is doing? I think India is started doing very well right now from the initial state. They already improve. So I would like to hear from you from Indian perspective how they are managing these current situations.
Yeah, I think this is the currently going the most sought after question and most uh, I will say the what we need to know and understand and globally very important question for every possible country. So I'll say what you said very correctly, Dr. Vishnu. Uh, the cases are increasing and definitely mortalities are happening. So that's definitely very unfortunate and sad events. But what we have achieved till now, I'll definitely like to focus over there as a health professional and definitely as a mental health professional. So first of all, by now, if you see the first case somewhere in March, after that, somewhere in February, actually in India, the reported first case. By now, we have an idea, we have a guideline, we have a plan. We have a plan to what to do and when to do. So I think that preparation, though we have learned the preparation with a quite of cost of losing quite significant time and some lives as well. But still, I think that improvement, that getting a clear guideline about how to act, that makes a lot of difference right now for every country. And also the awareness has increased. The some ideas about medications are there. I hope the vaccines will come soon as well. So there are definite gaps, the gaps of we are not very sure about pathophysiology. We are not very sure about the where the chances of mortalities are happening. But still, the positive things we never need to forget, and we really need to emphasis on that. That mortality rates are coming down, though the infection number, as it's a respiratory pathogen, is going to transmit everywhere. But case more than case number, fatality rate is important, number one. And also as a mental health professional, and I'll say, as you very correctly brought the public mental health domain, by now I will say overall, definitely there are quite gaps and pockets of negligence, pockets of ignorance, but still we have achieved some part of awareness, we have achieved some part of cautiousness, and the panic, fear, and the fear of unknown, which was very, very pertinent initially, the fear of unknown, and I don't know what is going to happen next, that has come down. And also, as I think public health experts will tell it better how long this is going to we are expecting. As definitely, I don't think at this stage nobody can tell the exact timeline, as WHO itself is changing its version, and that is very expected. We are learning, and it's very, I will say, the very effective way to see how evidence-based medicine works. So there is no predetermined notion this will happen this way. So what evidence is coming that way, the directive is changing, but our preparation is better, our acceptance is better, and we are ready for a long battle. I think that is a huge improvement globally, and in India itself, though there are the government is still struggling about maintaining the physical distancing, and also use of mask and other preventive measures. But still, overall, what I can give very uh, cross-sectional comment at this point of time, I believe the preparation is better, acceptance is better, and the readiness of the both the government and the individual level. If somebody gets infected, or for the family, how to isolate, how to maintain for the next 14 days, that preparation is quite well. So which is very, I will say, very satisfactory to see as a health professional and as a citizen as well.
Great. So, so basically, if we think about broadly, like so, COVID-19 pandemic is not getting over very soon. So,
Absolutely.
more infections, we will find in future more infections, and it's the most challenge is how to minimize the mortality rate, and that will be our strategic plan. So in future, like it will be great, like if we start to get ready for this kind of pandemic in future. So we don't know what will be the next pandemic is coming upcoming. So
Absolutely.
if public health, like we people are being aware, we people started preparation ourselves for the infrastructure. So how I would like to go to Dr. Surya. So how what will be the strategic plan to make this early kind of emergency preparations for in future or today?
Okay, let me clear one thing regarding COVID-19. There are so many confusion. Okay, as a I'm a community physician. Okay, and I'm bridge between actually in Nepal, where practicing the community medicine experts are practicing between. I mean, there's a bridge between public health and the clinical medicine. So we are treating cases as well as we are working for public health and the policy and the research related things, especially coordinating all the physical, mental, and social health. So in the context of COVID, what we have to know as a physician, as a clinician, we are, treating individual, or as a public health experts, we, as a population, perspective, we need to deal with large populations. Okay, so people used to say that the death rate, the case fatality rate is very less. Okay, but the thing is that the infectivity or the transmission rate is very high, and it's already proved that if we have comorbidities or senior citizens, the death rates it might be high. It's already proved in almost all countries of in the context of ongoing COVID-19. So if infectivity or transmission is high, then definitely it will increase the death number of people. In terms of statistical calculation, the case fatality rate might be low, but the main point is that if it infects more people, then the total population, in terms of population, it's not, less. It's more. So we need to consider. We need to, think about other perspective, not only the case fatality rate. We have only 0.001% case fatality rate, or 1.123 or 4 case fatality. It does not make sense in the context of pandemic. I think if we have high activity, one thing. So, as a perspective of individual case, okay, if he or she dies, okay, it's 100%. In terms of population health, it's maybe 0.001% of deaths out of infected in within some country or territory. But for that particular person, it's 100%. So we need to think in both perspective, because in that particular person, there are many dependent, family members or relatives. So we need to think as a population perspective as well as personal perspectives. Okay, from clinical perspective as well as from the population or public perspective, as well as we try to adjust case fatality rate as well as infectivity. So these things needs to be considered while advocating to public or population, because what happens in Nepal, people there are there are many media or even the concerned expert, they are advocating that the case fatality is very low, and people are thinking that we are safe, which is wrong message actually, which is wrong message. So we need to advocate in terms of other statistical parameters, and particularly answering your question, definitely the COVID-19 is one of the challenge for humanity. Okay, not only for Nepal, India, or US or other countries. It's one challenge. Actually, it's an opportunity for us. In a global context, it's an opportunity. And now what we have to think in terms of communicable disease or non-communicable disease or nutritional problem or injuries, we need to think about single individual or case as well as the population in terms of physical health, mental and social health. If we can't improve social health, we can't break the chain of transmission of COVID-19. So what is our need is, now we need to advocate, we need to help to strengthen, or we need to advocate community people. Without community participation, without combi approach, means communication for behavioral impact, we need to communicate in such a way that which can change the behavior of our individual. with their own participation. Otherwise, only the government, okay, different level of governments or NGOs, only the proper or specific health sector can't stop the transmission of COVID-19, okay, or in other pandemics. So we need to involve all the stakeholders. And what is lacking in India, Nepal is that the representation from population is lacking. Only the experts, so-called experts, used to be
Simon,
invited
basically, I'm
in the
totally
program. So that is the problem. Thank you. Over to you.
Yeah, so that's a great input. Basically, I'm totally agree with you. Until the strong participations from the community, it is not possible to make control in a short time. So, but there is a problem. What you already mentioned previously, Dr. Surya, you said the social acceptability, right? So
Yeah.
we have mental problem, like to accept who is suffering for COVID-19 or who already recovered for COVID-19. So
Yeah.
that's why we need awareness. uh,
Yeah.
I'd like to go Dr. Tanay Maiti to go through this point and explain why should not we do behave like that way, to other people who are suffering from COVID-19 or already recovered for COVID-19.
So yeah, I think I will say as an individual, as a professional, individual citizen, global citizen, professional, and as a mental health expert, this COVID-19 has gave us a real fact check, reality check, and fact check, and it said how things can go wrong massively, even if it's directly not on mental health. How stress or how something in environment can affect everybody's mind this globally. So we have seen it. If you go back, I'll just give some examples. As in one of my paper, I just mentioned it. So if you go back, this happened during the tsunami. This happened during the SARS pandemic or the Ebola pandemic, but it was quite localized. It was quite region specific. This is the first time, probably after the 1920 Spanish flu, it is this global. Everywhere people are affected, and we can see what we are saying. The other after the first infective pandemic, the mental health pandemic is starting now, and the pandemic is slow, but pandemic is having this mental health pandemic is affecting the community so big, so massively and so badly. You can see the number of suicides. So initially, the suicides are going. The suicides are not only directly happening for COVID-19. There are instances. There are papers has come out where just out of panic, I have COVID-19. What will happen to me? Or if I go back, how the community will accept me? Out of that itself, suicide has happened. Number one. But other than that, the job loss, the stress, the responsibility. We all know about the German finance minister. There was a U.S. We should know better. I think she was in New York. She was the chief of the emergency service. So she had a breakdown and she committed suicide. So what I'm trying to say, and in India, it's right now the self-harm attempts are so high, and the so many unfortunate early suicides. So every suicide, what I said everywhere, and what I said to my trainees and children, sorry, students, suicide is a one-time event, and unfortunately, once it's done, we can't prevent it. We can't do nothing about it. So it's always being ready and prevent it rather than there is no option of stopping or intervention after the event happens. So that way, as I'll just like to give one statistics. So if for every suicide, I'm just bringing the suicide more prominently as it's really becoming a concern for globally about all the mental health experts. So WHO says for every suicide, there are 20 attempts, not for every individual, but for every completed suicide, there are 20 self-harm attempts or parasuicidal behaviors. So that itself says the message is very clear. We have 20 times to stop it. We have 20 times chances to prevent it or do something before the actual event happens. And if we miss it, so probably somewhere we have lacked it. So that way, I will say, other than suicide, also you can any stress, any stress which affects us, be it a health related stress, be it a financial stress. So definitely it will somewhere land up and or end up into the mental health stress. So, but unfortunately, when we are all out trying to stop the infective pandemic, we are forgetting it. And what I was saying, we missed quite a lot of time initially where the mental health intervention preparation was needed to ready. We also didn't expect this is going to hit us this badly, and we lost quite a significant time, which has given us the lesson, or we have probably learned, hopefully we have learned, that we need to prepare for every stress. Along with the stress, the effects of the stress, be it a war, be it a natural disaster, be it a infective pandemic, because you really can't miss out your mind, or you really can't avoid your mind, because it goes slowly. The war happens, some bombing happens, you can see the collapsing building and the losing of life over the fraction of second. It's very evident, but what's happening behind, what's happening backside, that we really can't afford to miss, and hope we won't miss in future as well.
That's a great discussions, basically, Dr. Mighty. So today, we are really people. A lot of people are really depressed because there are so many economic conditions. Also, there are job loss. There are infrastructure. They are not getting doctors properly. So they have a mental health stigma. It's quite natural. So in spite of that, how as a mental health expert would like to guide them so that they can get more aware and get preventive measure to get out, like, get rid of mental health effect.
So yeah, I think this is the most important question and most important challenge for us as a professional. And definitely there is a stress, and if we deny the stress, or if we stay in denial, we know this won't affect me, this won't affect my family. That probably won't be very rational or otherwise at a well. This is a stressful condition. We all are stressed, we all are worried, and we need to be cautious. So accepting the stress, knowing about the stress is very important, number one, because denial, facing the problem, when there is a problem, we need to face it. There is no question of denial and no benefit of living in denial, because sooner or later it might hit us any day, number one. Number two, to understand it is happening everywhere. We can't escape it. Only thing we can do, we can stay cautious, we can stay protected, and we can do the best we can do at right now. So I'll just take 2 minutes. I'll just take 2 minutes to explain it. So it's about, first we need to understand the fear is real, and we need to do our best to keep the fear minimum and stay protected. If I say no, I won't fear, I won't wear mask, I'll go everywhere, I'll party, that's not wise. We need to be cautious, we need to wear mask, and we need to keep the fear as less possible. We need to stay prepared. Number two is, we need to understand that this is going, we have to live with this for quite some time. There is no magic moment is going to happen. One fine morning we'll wake up and see there is no coronavirus, the world has gone. So no magical thinking or expecting something miracle is going to happen. That's not the reality. Number three, I'll say, what we can do positively, that what I am saying everywhere, to keep our routine intact, even if the lockdown has come down. During the lockdown period, it was really pathetic. A lot of people just, we got started getting calls, and the problem relapsed because they are just not having, they can't go. They're just, I will say, burnt out sitting idly. That we also see this time so massively. So to keep the basic routine intact is given now is important. I say only 4 5 things we need to take care of: your sleep, your diet or nutrition, your daily exercise, your work, some work, and relaxation. So these 5 things, thumb rule, what we do regularly. Definitely, if I am getting more time now, we can have a more relaxed time. We can have some, we can watch 2 movies a single day, but that need to be structured, and that need to be taken care of everything. A lot of people having work from home, that doesn't mean we won't, those who are not having work from home, they can't do anything, they will sit idly. There are so many options to learn new thing, do new thing, and getting a better routine rather than passing the time idly. And most importantly, I'll say about one more thing about not to panic unnecessarily, or what I'll like to know Dr. Surya's view as well, uh, about not to get trapped into the infodemic. So right now, I personally feel it's little control, but in the middle of the whole period, there was a time where information loading, overloading was massive. Lot of meets, lot of WhatsApp forwards, Facebook, everybody is sharing everything. It's a chaos. It's a 4 point road traffic point where there is no traffic police and everything is messed up. So that is important. I will say, and this I will say, I practice it myself as well. There is no, I believe, for health expert, for policymakers, it's important how many people are infected, what is happening, the countdown, but we are not watching any cricket match. No point, no added advantage to know how many cases are there. Rather, we need to know what is the recent rule, what is the quarantine rule, what government is thinking, what are the hotspot, the basic things. So there is a lot of people. Initially, a lot of people has done. I have seen even the health workers and doctors. Today, the caseload is this. There is, for me as an individual, it doesn't matter whether it is 33,000 or 33,500. Let the policymakers look into it, but it matters for me as an individual, as a citizen of the country. What are the hospitals are there? Where how many beds are there? And what are the rules are changing? We need to know that, and we need to know the health practices. So, not to, what I'm trying to say here, not to follow every message. The messages, some, there are messages for health professional, messages for officials. So not to I will say, put your mind and brain everywhere. That won't benefit us anywhere. Rather, we need to know what will benefit us and what we need to know minimum, so that we can keep myself and our family safe. So I believe that selective abstraction and selective, putting focus over the selective information is very important, because as I already said, it's a huge traffic point, 4 point, and lots of cars are coming. And if I want to keep track of everything, definitely I will land up with an accident or messing up the situation.
Thank you very much, Dr. Maiti. I would like to go to Dr. Surya. It will be the last question. It's already 30 minutes over. So a lot of symptoms, like, which are very common with COVID-19, okay, in other disease symptoms. So that is impacting on public health, means the infrastructure. So how the doctors in Nepal are handling this crisis? I would like to hear how Nepal is doing.
Okay, good question. Yeah, you are right. Yeah, we all know as a practicing healthcare providers, the only challenge, the one of the important challenge in this COVID-19 is tip of iceberg phenomena. That means, so we have lots of asymptomatic cases, and we don't know they are without having any symptom, even PCR negative, and they are the potential source who are constantly transmitting disease to the other public as well as to the healthcare professionals. And in our healthcare setting, we are getting number of asymptomatic COVID-19 cases. Even after confirmation with PCR, uh, they can be, symptomatic after admission to hospital. And we are facing this problem. So we used to, nowadays we have, good capacity of PCR testing, and we ask for PCR testing to all our clients except in emergency. And at the time of test, they it's came to be PCR negative. And after operation, after admission, and they will start having fever and other symptoms. And if we ask for PCR test, repeat PCR test, and it will, it used to be, positive. And it's really challenging. It's quite tricky. So what we are planning, we need to, think that our every client or patients are COVID positive, either PCR negative or PCR positive. It does not matter anything. We need to prepare for universal infection prevention mechanism or guidelines in each healthcare setting. Now people are thinking about, and actually people are practicing universal infection prevention control and even physical distancing if possible, to healthcare setting as well as at general setting. But the problem is that the healthcare profession is quite different. Okay, we need to be in touch with our patients. Okay, there is no chance of physical distancing, and there are lots of other cases. We have lots of endemic cases, so it's really tricky and it challenges our non-COVID cases and comorbidities. So we need to think about all our endemic cases as well as ongoing pandemic or epidemic as a COVID-19 cases. So we need to, really think about this. And what I want to is that we need to go for participatory rural appraisal. There are two appraisals actually. One is RRA, rapid rural appraisal. Another one is participatory rural appraisal. Means we need to participate community, okay, community people or all the stakeholder who are concerned to prevent and control COVID-19. And actually this is lacking not only in Nepal, throughout the world. Okay, there are many good practices within society regarding infection prevention. We have lots of good culture regarding infection prevention, actually, which is not even circulated widely in the global community through the research paper or through general communication through media. So we need to engage those community people, and I mean all the stakeholders, and that will be beneficial to prevent and control COVID-19 and other future outbreaks and other disease and disorders. Over to you.
So I got a question, so I have to take it. So Tonoy Maiti sir, can you please highlight? Sorry, just 1 minute.
Other future outbreaks and
The questions. Yeah, Tonoy Maiti sir, could you please highlight how to deal with the elder member of our family during Corona pandemic?
So I think, yeah, thanks for the question. I think this is very important as what we say spatial population, the children, the pregnant, the elderly. The spatial population always needs spatial care. We can't generalize their needs with the common public's need, and we need to be spatial cautious about it. So if you think, just to first recap about the challenges, elderly people, they need support, and during the lockdown, it happened with a lot of people where the family members stuck in different cities. Elderly people are the children, the family members are working in other city. They can't come. So you can understand the level of panic. If my father or my mother turns ill, nobody is there to take care of them. So it's a panic in the both the sides. Number two, they have less social support. They are not going out. They have less social support, and they are that makes them vulnerable more towards mental health problems. Number three, everybody knows from the media, elderly people are having more prone, and the level of comorbidity is more, and the level of chance if a elderly person turns COVID positive, then probably the chances are more it will turn complicated. So they also know it very well, and that will make them more fearful. So with this challenge, I believe the support and being there matters a lot. First, to understand, accept the problem. If I'm a 35-year-old person, I'm a 45-year-old person working, I have a good social support, I have friends whom I can call, I have work, I'm engaged. My condition and a 65 or 75-year-old person's condition, the physical condition and the mental condition is totally different. First, to understand that, accept their problem. It's not just the problem is happening because of their old age, but also for the environment situation. Number three, I will say the support, what I was telling, it's all about what Dr. Surya said initially. And I think it's all about physical distancing. It's never social distancing. Just be there. I said everybody, we are getting patient where the children are worried about their parents during the lockdown period as they can't go. So make a support system, be in touch with the local hospital and the local people who can save at the time of if any emergency arises. And even if you can't visit your parents every day, or you are stuck somewhere else, do a video call, be in touch. Believe me, the support and the mental support, I am there for you. If anything happens, I am there. Even if you can't go and hug your parents and say, yes, don't worry, Papa, nothing will happen. Apart from that, if you can't do that, but if you on video call, if you spend 5 minutes, 10 minutes with them, if you make them sure you are there, that matters most. So I'll say support, and being ready for the situation, being ready for the emergency is very important, because if to stay prepared rather than to act when it happens. So staying prepared, providing the support is very important, and definitely engaging the elderly people into the daily activities. Engage them, make a group of them virtually, teach them the virtual platforms. They will enjoy. Definitely, it will take some time. It's not that a 20-year-old young person who can learn it in seconds. Definitely, they will take more time, the elderly people, but be patient, have patience with them, be compassionate and understand their situation. And definitely the difference of mindset, the different challenges are different. So I believe that makes a lot of difference. And to be around, even if over social media, even if over a video call, in the current situation, that makes a huge difference. Over to
Uh,
Victor.
So that's a great answer. Basically, we came to know a lot of thing about that to how to care elderly people. Now I got a personal message. Basically, I'm just okay. So her kids is basically getting angry too much, and how to control. Like she's getting she's trying every way, but the kid is not getting control. Like he's getting the behavioral change, a lot of finding behavioral change, angriness. So how do you want to guide people for taking care of kids, because kids are not going school, they are at home, and it's a really big problem for the parents also, because they need to work, they need to have a lot of responsibility. But in this situation, how do you want to suggest?
Absolutely. I think that's a very good question, actually. And I mean, it's not any individual is facing it at every home. Most of the home
Yeah.
people is facing it. As you can understand, I again will go to the special population concept. So when it's 25 to 45, working man or woman, their challenges are different. And when it's kids, elderly, pregnant, or mother child, their challenges are different. So we need to understand that, and we need to understand the kids' world. They don't have friend. They are right now the online classes are happening, it's little better. But if you think for the kids, and kids with, if I go further date, the children with the who need special support, children with the children with a neurodevelopmental problem. So you can understand somebody, a child with a problem of autism, if he or she was having therapy, suddenly the therapy stops. A lot happened a lot with a lot of my patients. Suddenly the therapy stops, they don't getting the medicine. So it's a actual panic, as you know, for a children who is thankfully doing very well. Managing them itself turns very difficult, as Dr. Bishop said very well, yeah, about they have work, they need to maintain everything. So the solutions, I will say, there is no one point solution to every problem, and the problem is actually, I will say, the problem is actually very real. So first of all, again, I'll go to the routine thing. Make a routine, make some more involvement, be compassionate to them, make them, teach them to learn something. You need to, they have, if a child with, even if he or she is not having a neurodevelopmental problem, then also he has a lot, 24 hours, he has a lot of energy. So we need to spend the energy thoughtfully and scientifically to involve. And definitely nobody, I don't like working for 4 hours at a stretch, neither any child will like. So make it in routine, be careful about the routine, and make it enjoyable. You need to put some extra effort. The child will won't learn one single day, a fine morning, okay, it's lockdown, everything is closed, oh, my father has a job, my mom has to attend office meeting, so I'll be do this thing. So don't expect the child to become the father. You are the father, you are the mother, you need to take a little more responsibility. And also, I'll definitely mention here about the children with special who need special support and neurodevelopmental problem. As a I will say client or patient, we have seen a lot of them, and I was actually worried about initially about the problem. So first, maintain the medications, whatever your doctor has written. Try to maintain this routine and therapy, even if online, do it at home. See, the the situation is there, we all are taking extra responsibility. Being a health professional, be it a work, if you are working as an IT professional, things are different. Everybody, it's a new normal. It's a change scenario. So we need to cope up. We really can't fly away or run away from it. So, but be prepared and understand a child who is having an ADHD problem or autism problem, he or she will be irritable. This is a very irritable situation. You can't go out and you can't channelize your energy or irritability. So the preparation and keeping, I will say, the keeping the preparation moving about, like, this is a very simple and very, I will say, very minor advice, but it how you don't believe how much it has it turned important about to get your medicine before it finish. So we are not living in a situation where tomorrow today my medicine is finishing, I'll buy it tomorrow morning. It might not happen. You right now it's better, but after before 1 month, even if your medicine is finished, you might get the medicine after 7 days. So that 7 days can turn really tough and challenging for you. So just be active before the actual challenges come. See the next 7 days. Plan always for the next 7 to 10 days. And for children, definitely it is important. Understand it is a very natural for them to get irritable, to turn very cranky, but as you are the parent, you are supposed to take more responsibility and channelize energy, make them involved in learning something new, something, be it web based, be it real based. Spend your time. You will also find better if you paint a drawing with your child. So spend time together. And believe me, children are at least 10 times smarter than us, and they do understand. If you spend your time, if you then explain them that this is a change situation, we need to cope with them, you explain them, they do understand. So don't lose your patience. Spend your time with your child, use the child's time wisely, and maintain a proper routine. I think that is very important. That's very simple advices, but that works very beautifully.
So, really, thank you very much, Dr. Surya Farajuli and Dr. Tonoy Maiti. So, it was a great discussions on why public health and mental health are the real future. Yes, we should care about public health and we should care about mental health. So, in this discussions, I would like to mention from nuclear health because you mentioned one point, that is infodemic. Yes, there is a infodemic, and infodemic induces more stress on people because of the fear they produce through their misinformation. So that's why we need to be selective. And I would like to make sure that nuclear health, I am a scientist. So nuclearhealth.in is an emerging health science news portal, and it is available on English along with Bengali and very limited Hindi right now, but in future we'll make a full form of Hindi too. So please follow nuclearhealth.in. We bring very limited blogs and which are very authentic and which will enrich your medical biomedical science and knowledge, and basically nuclear health stands against the infodemic during this corona pandemic. So thank you again. I would like to thank you on behalf of Nuclear Health, Dr. Surya Parajuli and Dr. Tonoy Maiti, and along with our Nuclear Health family members who are I basically. I want to mention them as a family members because they are with us for a long time, and since 2 years we are interacting each other with every kind of people in this platform. So thank you very much for joining us, and it's a really we are enriched by your presentations, your informations, and hopefully in very short time we'll defeat the pandemic collectively. Thank you very much.
Thank you, Dr. Vishnu. Thank you, Dr. Surya, for making time. And it's a real honor to be all of
Okay.
Thank you.
Nuclear Health, Dr. Vishnu and Dr. Tanya from my side and from Nepal.
See you soon.
Thank you very
Thank
much
you.
for this opportunity.
Yeah,
Good
it's a
night.
great meeting. Yeah, thanks.
Thank you.
Bye.